Hi, it's Ask Dr. Ben. All right. First question on this Tiny Shark Thursday is from Mindy. Hello, Mindy. Hi, Dr. Ben. Local pastor of a small congregation here. We're probably going to begin worshiping together again on May 31st. All right. Spreading out and sanitizing hands and such. What exactly is the danger of singing if we are spread out? Can you explain the science on it? Would it be safer if we were singing outdoors? Yeah. It would be safer if you weren't singing near each other. I think, like even in the same room or facing each other. So there was a neat paper that came out, I think, yesterday, and it was on the spittle physics of just ordinary conversation. So they were measuring the size and amount of respiratory droplets, these things that come up from your throat and from your mouth and just sort of spray whoever you're near. The problem with singing is, at least anecdotally, there's that story of a choir up in Washington State where one person was infected and then the entire choir pretty much got infected, and they think it might have just been in one choir practice where everybody got sick, which is pretty crazy and a fairly terrible price to pay. Yeah. um, so any sort of vocalization is going to bring stuff up from your throat. There are going to be cells down in there that actually have the virus in them, and there may be some at the top of your nose, but I'm assuming you're not singing or singing through your nose. That would be weird, right? Yeah, it's not how singing works. And so if that air is passing over and it picks up some viruses in a little droplet and then sprays them out, then that is the way that people can become infected, and so that's what we'll be trying to protect against. Doing it outside means you're also involving wind physics. I mean, instead of a straight shot from one person's mouth to another, it can be, a little curve with the wind. But other than that, no, it's not going to inactivate the virus or anything like that in time to do you much good. It's risky at this stage, I would say, singing together in a room. If everybody's wearing masks, I guess that can be all right, but I'm guessing from the sound of it that maybe people aren't. In which case, yeah, that's just, I don't know. I want to be able to be positive about this, but it just sounds dangerous to me. Texas is at kind of the peak. We'd sort of leveled off for a while, and now we started ticking up again since the reopening. And so there's more virus around today than there ever has been before. It's just that most people aren't going to know that they have the virus yet. And so, yeah, it'll either be all right or you'll end up with a whole bunch of people infected in a cluster. And I don't know, that doesn't sound like taking care of people. So it's, yeah, ultimately it's a free country, I guess, but I can't recommend in favor of seeing. And anyway, that's the science. That's where it's coming from. These respiratory droplets have enough virus to actually infect somebody, and they're going to tend to travel farther out of you. They just got a little more mass, a little more inertia. They can keep going. Thanks very much. This is Ask Dr. Ben.